welcome to our webinar this evening. My name is Dina Matos, and I'm the Executive Director of CARE Foundation. Those of you who are not familiar with CARES, we are the only U.S. organization solely dedicated to patients with congenital adrenal hyperplasia. We have been around a long time. We just entered our third decade of serving the CAH community across the U.S. and we also have a number of members from across the globe, but primarily in the U.S. So our agenda today, or topic today, is care models and advocating for yourself. So we're using the care model at the center of this conversation. It's also referred to as a patient-centered medical home. While these are not new concepts, it is a model that is available to help support those living with rare disorders, such as adrenal disorders like CAH. And it puts you, the patient or the caregiver, at the center of care to better advocate for yourself or your child. We encourage you once again to use the chat feature to ask some questions during the presentation, and we will do our very best to get to all your questions. If we cannot get to those questions, we will find a way to get those answers to you. So please ask your questions in the chat box. So now I am going to turn it over to the new CEO of Spruce Biosciences that is co-hosting with us this evening, along with Think Genetic. So Javier.
Sure, I'll be happy to intro myself and then get us going. Good evening, everyone. I'm Javier Schwartzberg. I'm the CEO of Spruce Biosciences, where we're working towards expanding treatment options for patients suffering from adrenal conditions. Welcome to the 2022 webinar, Adrenal Disorders Series. And our goal really is to bring important topics for conversation to you all on a quarterly basis. So again, thanks for joining. We're thrilled to that you've chosen to spend your evening with us, or at least 1 hour of your evening with us. And we hope that at the end of the webinar today, you'll be able to understand more about advocating for yourself or for the ones that you care for. Again, Dina mentioned it at the beginning, but this session is being recorded so that others can watch it later on offline. If I may go to the next slide. So we're kicking off this series with the topic that Dina highlighted, care models and advocating for yourself, in partnership with the CARES Foundation and Think Genetic. I'd like to introduce, Dina, which she did at the beginning as the Executive Director for the CARES Foundation, and Don Laney, sorry, I mispronounced that. She's a professor of medicine and human genetics at Emory University and co-founder of Think Genetic. And with that, I'll pass it back to you, Dina, to get us going.
Thank you, Javier. So that brings us to polling question number 1. As I indicated at the beginning, there is a polling feature at the bottom of your screen. So the first question is, the condition that I live with or am a caregiver for is, and here are your choices. So CAH, classic or non-classic, PCOS, Addison's disease, adrenal leukodystrophy, or other. We're going to give you a couple of seconds to take the quiz. Okay, can everyone see the result of the polling question?
Yes.
Okay, so it looks like CAH is 57%, 0 for PCOS, but I'm sure we'll have some more people join us. Addison's disease, 22%. Adrenal leukodystrophy is 0 right now, and other is 22%. So if you want to indicate in the chat box what some of the other conditions are, we'd love to hear from you.
All right, so I will jump in right here. So, hi everybody, I'm Dawn Laney, as I was so ably introduced by Dina and Javier. I am not only a professor at Emory in Atlanta, Georgia, but I also serve as what I like to call as a quarterback for a series of care models for patients who have lysosomal storage diseases. And I've been doing this for about 20 years now. So when Dina and Javier and Carol came to me and said, hey, can you talk about care models? I said, yes, because I am very passionate about care models. As both Dina and Javier pointed out, care models are really a way of focusing on the patient, improving communication, and really trying to get better patient care and better health outcomes through communication. And we've got a great illustration of what that is here. There's a little animation on this slide that I think we can show here. And we can move on to the next slide. There we go. See, the heart of the matter is our patients and really trying to do the best care that we can. Next slide. So what is a care model? We just defined it for you, but from a practical purpose, what is different how you see a doctor now versus if you were part of a care model? And really the difference is that a care model is designed to work with people who have chronic health conditions so that we can get better communication between the patient and the caregivers and the providers, but also between the providers and everybody else. And a way that in this way we can communicate across all the different specialties and really get to the best treatments, the best cares, and best management. We also want to have a really strong game plan. In fact, sometimes I refer to myself as a quarterback for my patients. My job is not to be the expert. My job is to pull all the pieces together and develop a great plan to give people better care. Now, traditionally, what the model would be is you go see your primary care, you tell them you've got a problem, they're like, oh great, let's send you to a specialist, or let's get this lab and then decide if we're going to send you to a specialist. The specialist gives some information, you get some more medications, you really try to figure out piece by piece how to do care for yourself over the course of your life. The problem with the traditional model is it used to be that we were in smaller settings, smaller towns, and we were able to maybe have that person know us outside of the medical setting. And maybe your doctors actually would socialize outside the medical setting. So if we all lived in Little House in the Prairie, a traditional model would be fine because they'd all talk, we'd all talk, they'd see you, they'd know what's going on. They say, gosh, you don't look so good today. But we are not there, you guys. We are so decentralized. We have a primary care physician who may not be anywhere near the medical center or have privileges at the health center that you're at. You will have a specialist, maybe the best specialist you can see, but they're in a health system that's not related to your other health system. And so what we get is decentralized care without coordination. If I ask anybody who's on this call, you ever had labs drawn twice in a row because your doctor in one site hasn't seen the results from the other one and it's just been too much bother to get them? I would say myself, I've even run into this problem, and I don't have to go to a series of specialists other than one or two every now and then, right? A cardiologist, maybe I get a mammogram, maybe I go to my OBGYN, and they don't talk to each other because they're all in different settings. So one of the questions that we got ahead of time before we moved into this lecture was from Violet, and Violet said, hey, can all healthcare facilities have access to care models? And the answer is yes, but in some health centers, they're going to have a formalized path you can follow, and different providers are trained in how to do it. In other ones, you're actually bootstrapping it up and making it yourself. So the model is good no matter where you go. And the level of how formal it is where we get into a little bit more differences there. So let's go ahead and move on to the next slide. Who's part of your care team? So we talked about what a care team is. We talk about the difference between a traditional model and the model we're working with now. But who goes on your care team? The answer is everybody. Everybody who touches you in the medical field, everybody who might be really important when they're taking care of your CAH, when they're taking care of your Addisons, whichever condition you're working in. And remember, the way we think about specialists is specialists usually do it by organ, right? So they're like, oh, my system is the endocrine system, and my system is the heart system, and mine is orthopedics. You know, maybe you've got a complication related to your bones and the strength of your bones. Dietitians, nutritionists, they focus on things that go into your body and how you use them to fulfill all the processes to make your body run to its best ability. Your OBGYN, all focused on the reproductive female health and having babies. Urologist, all about the plumbing. And when we talk about mental and behavior health, really in charge of trying to make sure that from a mental perspective and emotional perspective, that things are going as well as they can for you. All of these people are incredibly important as part of your team. So how do we get all of these care team members working together? Next slide, please. Often, oh, sorry, we've got a care team here. So we want to learn from you. Dina's going to ask you this question.
So, you just saw the slide, and Dawn discussed all the possible members of your care team, but we want to understand which of your healthcare providers does the most to coordinate your care. So is it your primary care physician? Is it pediatrician, endocrinologist, OBGYN, behavioral health, physician assistant, or other? If it's other, please be sure to put it in the chat. We'll give everyone a few seconds to respond. Okay. Okay, so can everyone see the results?
Mm-hmm.
All right, so Dawn, someone put in the chat geneticist.
Mm-hmm.
So that's your quarterback, Dawn.
That's right. There's a quarterback.
So here we are. So 43% for primary care physician. The next highest is endocrinologist, 39%, which is a bit surprising to me, but not really, because the majority of our patients, their primary provider who does the coordinating is the endocrinologist. So then we have followed by pediatrician, and that's also very surprising, 0. OBGYN, behavioral health is 0, and physician assistant is 0. So I don't know about the rest of you, but some of these are surprising to me.
Yeah. I think that what we're hearing is a great message, is that you can have a person who coordinates most of your care who's not someone that you traditionally would put in there. When we think about primary care physicians and pediatricians, we think about them as treating the whole body and then sending you off for specialists for different pieces of it. But I think over time what we've learned is it's more about the ability of that provider to communicate with you, communicate with your other people, and get records together, and really become part of a partnership with you and your care team, as opposed to just a specific role that they're supposed to play. And I think, I think somebody put in there that they've been working with their foot doctor, and their foot doctor is coordinating a lot of their care. And I say, yay, because if you find that person who may not be the expert in CAH or may not be that expert in Addison's disease, but is willing to learn and is willing to help you coordinate your care, then you stay with that person as long as you're getting what you need there. Again, often the primary care physician on the care team is going to be in that quarterback role. But when you've got a rare condition, it may be somebody else who's a specialist. When you think about the role of a primary care physician, one of the most interesting things to me is in my role as quarterback with my patients, I often say, like, okay, who's your primary care physician? And they say, I don't have one. I have, an endocrinologist. I have an OBGYN. I have an orthopedist. I have a rheumatologist, but I do not have a primary care physician. And I'm here to tell you primary care physicians are critical for the care team, because they're the person you're going to go to when you get poison ivy and you need additional steroids. They're the person you're going to go to when you have the flu or you need maybe the COVID vaccine. They manage so many of those day-to-day conditions that your specialists are not going to touch. Sometimes a primary care physician can be the best person to centralize your medications. Because when you go to a doctor, let's say you're having a dizzy spell. If you go to your primary care physician, they'll look at your list of medications. They'll say, okay, maybe I'm not the best person to figure out what could help your dizzy spell, but maybe I'll send you to ENT if I think it's related to this, or I'll send you to cardiology if it's related to this. What if you go to both? They both prescribe different medications, and they both were completely independently thinking about it. Or maybe they prescribe the same medication, and then you've got to figure out which dose you're supposed to take. So that's where a primary care physician is invaluable in helping you manage and understand what's going on with your medications. And it's so nice to have one person you call to get refills in your pharmacy, as opposed to trying to remember who prescribed which one. Next one. Here's a question for you. Have you ever had labs? Oh, I'm going to let Dina do this.
No, that's okay. So the next polling question is, have you ever had labs or tests performed twice because the results were not shared between doctors? I know I certainly have.
Mm-hmm.
Give everyone a few seconds to respond. Okay, so this is interesting. There are quite a few people who, it's about 50-50, those who have and have not. So great for the ones who have not had to do testing, more than once, or the same test or same labs. So we have 48% for yes, 48% for no, and 4% for I don't know.
Wonderful. And I think sometimes you end up not getting labs drawn twice for the same lab, but maybe they forgot one lab that was really important for your endocrinologist, but focused on what was important for your cardiologist. So you end up having more blood draws, but not necessarily the same labs. Also an issue that we run into. Now, when we talk about primary care physician, we're talking about family practice, we're talking about internal medicine, we're talking about pediatricians, but also, particularly when we talk about CH, Addison's, other adrenal diseases, we're thinking about a specialist as somebody who focuses, again, as I said, on a particular system. When we talk about endocrinologists, really often is a specialist who's thinking about how your adrenal function is working, they're thinking about your electrolytes, they're looking at you as a whole person, but really focusing on your hormones. Your endocrinologist can often serve as a care team leader. And I've heard from folks with CH in the past that often their endocrinologist becomes their quarterback, that they're going to be the person who's going to monitor everything that's going on. They're the ones who puts together that care plan and then will coordinate with your primary care physician and other team members. One thing people often ask is, is there a specialist in CAH? And the answer is, oh yes, there are. There's some amazing centers of excellence, but there's only 8 of them. And that's why when we talk about a care plan, that center of excellence, if you live close to it, may be your care plan team quarterback and taking care of everything for you. But often your local person is going to be your main person in this care model. You're going to be the quarterback. And then your center of excellence is going to be a really important spoke on that wheel. But again, communication is key. You have communication back to your local folks from the specialist center, and then with the rest of your specialists, whether they're local or over the center of excellence. The other important thing about specialists and primary care is they help you transition from being a child or an adolescent where your mom and your dad takes care of everything you need until you take care of it yourself. So transitions are particularly important in this role. And Jennifer asked a question, submitted it earlier on and said, hey, can you talk about care models and how young adults transition from pediatrics to adult care? Because anybody who's done had a chronic disease and been in the pediatric world and then moved to the adult know it's a very tough transition. The way we set up with pediatric hospitals, the way we set up with pediatricians and pediatric specialists, they really tend to be more focused. They want to know their patients. They really want to understand and be part of that patient's life. And that's the way it's set up. You have more services in pediatric hospitals. You have more care. And it can be a rough transition to an adult where they don't coordinate as much. But we can make that easier. And the way that we can make it easier within a care model is to prepare that teen, that young child to do and be in charge of their own medical care. And you take that like little baby steps, little bit at a time. Like your job today is you're supposed to have your annual appointment with endocrinology. I want you to call and make that appointment. Now, I very recently tried this with my child who's got scoliosis, right? He said, I need to change my appointment. And I was like, okay, then you need to call your brace specialist, your
Join the meeting.
And I want you to go and call over to Scottish Rite and tell them that you need a different appointment. Well, he ended up making an appointment for a new brace fitting. But after that, we troubleshot. We're like, okay, you don't actually need a new brace. You just need to see that you grew 2 inches and see if it fit differently or if they need to make some changes. And I think it was a great learning lesson. And I think the same thing holds true for any young adult who's moving from pediatric adult care. Your care team plus your parents or whoever caregiver you're working with has to develop a baby step plan so that you know how to slowly do each piece of medicine. It's not like adults magically know what to do with their medical care either. So, sometimes adults as well need a little help trying to figure out how to transition and see different specialists.
And if I could just add to what Dawn said, so part of the question was about transitioning to college, and that's super important that you empower and educate your child or your young adult on how to do that. And the first step is to make them take ownership of their own health, because we've seen where lots of young adults get really ill when they go to college. because they don't tell anyone about their condition. So it's really important for them to tell their roommate, all right, I have CAH. This is what happens in the event of an emergency. I have this injection that I have to have, or you have to call 911, get me to the hospital. And they should also go and meet with the medical team at the university before they move, so that they are aware of their condition.
Absolutely. Good point. And also, where do you get medication refills? Where do you call, and how far in advance do you call to get your refills done? Because you don't want to wait till Christmas until you go home over the winter break to get all your medications refilled. You may run out. And if you are getting ill, say you think you have mono and everybody in your floor has mono, who do you go talk to if we're being local and they're concerned that you might need to have a little extra boost, with what you're doing with your glucocortisol? Okay, so when we talk about those specialists, those CAH specialists, those 8 centers of excellence, these are people who think about CAH all day, every day. These are physicians who know all sorts of interesting things, all these little tips and tricks and ways that you have better care and have better health outcomes. They're also the ones who are paying very close attention to what new therapies are coming down the road, because they often are the centralized hub of clinical trials. Just because you don't actually see that center of excellence doesn't mean, though, that you can't talk to them, learn about clinical trials, or even be referred to see them. Often travel and things are covered when you're doing screening or learning about a clinical trial. So when you think about these 8 centers of excellence, I don't want you to think that you can't go them and access them and your physicians can't consult with them just because you're not a patient there. These are folks who live to give good advice and talk people through what they've done to really help outcomes. So they are an important member of the care team, even if they aren't a central point there. One wonderful thing to find these centers of excellence is to look on that CARES website, because on that CARES website, they've put a lot of care into finding out, who's the best person to contact, what do they do there, where are they located, and, as things move into clinical trials, they're going to be your hub as well. Next slide, please. Okay, I told you how fabulous it is. I told you who's on it. And you're like, that sounds great, Dawn. Now, how do we build it? Well, here's the deal. It sounds great, but it takes work from you as well as your doctors. So the first thing is to look at your doctors that you have now and say, who is the person who communicates best with me? Who is the person that I get called back when I call them with a problem? Who is the person that currently writes my prescriptions? And is that person doing what I need? If they're not, but they've been your long-term provider and they know you well, this is the point where you sit down with them and say, I am trying to build a care model now. I'm trying to make a patient focus where we have a partnership to get me the best care possible. Are you interested in being on this team? If they say, yeah, tell me more about it, I don't know about a care team, then you could call it patient-centered home and they might know better, but there's different names and different people learned it in different ways. But having that sit down with the doctors you already have is the first part, because if they say, no way, I don't like that idea, then that's when you want to say, what do I see this doctor for? And do I need to consider what they do for me, and if I can keep working with them if they're not interested in being part of my care model. We're not firing anybody. We're just trying to figure out, if you have a strong care model and then one person on the outside, how do you find that really good quarterback who can pull people back in? The other thing that can be really useful is you might talk to a center of excellence, a CAH, which again, you can find on the CARES website. And because they can tell you who they know in your area, if there is someone who's already doing a great job with a care model. They can say, oh, we just learned that there is an orthopedist who really specializes in steroid-related bone disease. He's here, you can talk to him there. And that can be incredibly helpful instead of you trying to do the research to find somebody, or your primary care, even if they're becoming your quarterback, who doesn't really know who might be the most useful person in that case. The other thing you need to know, once you've got your care leader who's going to coordinate your care and your specialists who are going to be involved in this, learn about the other pieces that are so important that might in particular situations. And Donna really emphasized one of these points, which is who's a hospital patient advocate and how can they help when we're not getting the meds we need or lab tests. Lots of people don't know that in the hospital, if they're accredited through the Joint Commission, which is a big organization that accredits hospitals to do the best they can be, there is someone called a hospital patient advocate. And if you're concerned about the care you're getting, if you need someone who can help you access resources, if you need someone who can find you a social worker, or someone you just need to complain about. If you're concerned that your medicines are not right, or you feel like you got substandard care, this is the person who talks you through it and helps you out. It's basically a person who's there for the patient or the care team or the care provider who's right there in the hospital who can help you in one of the most stressful situations you could ever be in. So Donna did a great job here in pointing out that hospital patient advocate, and this is someone you can request to talk to. Or if you complain, often this person will show up and say, hey, how can I help you? And utilize them. This is a great resource. Don't be afraid to let it all hang out. Tell them what you're worried about, what you're concerned about, and they will help you. Next slide, please. All right, we're going to do a little transitioning here into advocating for yourself or a loved one. One of the most frustrating things I think that people have when they're seeing their physicians, their primary care physicians, or their specialists is the recognition that they only really have a certain set of amount of time designated for an appointment. And if you are going into an appointment with an expectation that you're going to discuss an issue that's really important to you, and your healthcare provider is on the page of trying to figure out their own agenda they have on there. They think you need this, you think you need that, you come together, you only have 18 minutes, nobody's happy because you didn't get the concerns you have addressed and they didn't get quite what they wanted. So what you need to do is when you make that appointment, tell the scheduler, tell leave a message for the nurse, leave a message for the administrative team, go through the patient portal, tell them what you're worried about. Because if it's in the medical record, your healthcare providers are going to read that medical record or just scan it and be like, oh, look, they just had a question about this. So they can mentally prepare for when they go into that room, they're going to ask you about this. Now, of course, you're not going to do that every time. So what you want to also do is prioritize a list of questions that you want to get answered while you're there. And do not let that provider out of the room until they've answered your questions. They maybe have their hand on the door, but if they didn't ask you, you have any other questions, you can say, hey, I do actually have a list of questions. Would you mind sitting down again with me and talking about it? Now that takes some guts, you guys. This is something that you may not feel comfortable with, so you got to practice it. You can practice it at home with your friend, with your spouse, with your kids. You can practice just feeling empowered to tell people, hey, healthcare provider who's incredibly busy, can you sit back down and talk to me for a sec? But in a respectful manner, right? We're not being like roping them down and tying them to the chair. We're just trying to make sure that they understand that you've got some questions and that you feel like they would be a great person to answer them for you. And if they're not, maybe they can direct you who would be the right person to answer them for you. I think that doctors and other healthcare providers are people too. Don't forget to thank them. Don't forget to tell them if they did a good job and respectfully let them know if they did a bad job. Because nothing makes a healthcare provider less willing to go the extra mile for you is if you felt one of those surveys and tell the overarching hospital survey what a horrible job you thought they did when they felt that they did a good job for you at your appointment. So be honest, be respectful, but also get your questions answered. Next slide, please. So this is just reemphasizing a little bit more about what we talked about, which is when you're making your appointment, make sure you know who you're seeing. And within that facility, who is the person who can tell you what out-of-pocket expenses might come out of that? Because your insurance may be fabulous, but you may be seeing a provider who is not in network. Or your insurance may be not so great, and you need to know what other patient assistance programs are out there. And sometimes the scheduling team doesn't know who that is, but they can direct you to the person who is. Sometimes, like at Emory, when you come and check in, if there's something they're worried about, or if there's a copay you can't pay, literally sitting next to our front staff is the billing coordinator, and they will sit you down and talk to you about what the options are for that. The other thing to think about is that in medicine, we use a lot of crazy pants terms, you guys. They're like this long, they're based in Latin, they say dis or a or over, and then we start talking about the medications and they all sound the same. We're like, this is a this-oid and this is a that-oid, and you're like, what are we gonna do with that? Ask how you spell it, how do you write it down? When we talk about medications, some of them have very similar names. Don't feel bad about having a list. Sometimes every time you check out of a doctor's office, they should give you a list of the medications they think you're on. If it's wrong, fix it and carry it around with you and show people. Because if it's in the system in one area that your medications are wrong, I guarantee it's wrong for the whole system until you get it fixed. That shouldn't be a hard process, but sometimes it is. Sometimes it takes a while for those medicines to get reconciled. So just keep telling people, because the last thing you want is them to think you're on something when you're not. The other thing about symptoms is I know when you've got a chronic disease, there's a lot of health problems going on with you. There's a lot of things that in your mind may not be a big deal, but for a physician, it might be a clue for something else that's going on. So I would still make sure, even though you feel like you're just telling a laundry list of everything that's wrong with you, still mention things if they're a little bit different. If you're dizzy more often, you could say, I think it's because I'm getting up too fast, but I seem to be dizzy more than I used to be. And then if you can, tell them in what way it's different. Is it more frequent? Is it more severe? Did you pass out? Did you hit your head in the bathroom floor when you did that the other day, getting out of the bathtub? These are things that can be clues that can be really helpful for your doctor. Now, when it comes down to the big questions you want answered, I recommend always thinking about your top 3 things that you're worried about. Because if you have 3 things that you for sure want to get an answer on, that will be really helpful, and it can help narrow down how your doctor is thinking about all the symptoms you're going to tell them about. Next slide, please. So what's the other thing? The other thing, and Dina, I'm sure, has some good thoughts on this too. You have to be empowered. You have to understand your disorder. You have to know the medications, whether it's you or your loved one, in order to get the best care. Because you have the ability to say, that's interesting. You know, I did try this medication and it didn't work for me. You need to know why that they want you to take that medication and why it didn't work for you before. And this really means knowing all that you can about CAH, about Addison's disease, whatever adrenal issue or other chronic health condition you are facing. You've got to be empowered to understand what's going on with it. And just like I said, sometimes you got to practice. Remember that there are also people out there in the world. There are people who are your peers, and you can find them through groups like CARES Foundation, and they will help you navigate things. If you're like, I went to the doctor and I told them all about this issue that's going on with me and how I'm having bone pain and joint pain and it's new, and they're like, oh, well, you probably have carpal tunnel syndrome. Is that something you saw? Like, what did you do and who did you talk to next if it kind of like didn't seem to be taken seriously, but really it's one of my top 3 things I want fixed right now.
And
goes a long way.
Just to add to what Dawn said, so sometimes you as a patient or a caregiver know more than the primary care provider that you're seeing, unless you're at a center of excellence. And often patients or parents are going to the doctors and saying, well, I know that there's new medication or a new trial. I want to try that. So can you prescribe that new medication? So you really have to advocate. The doctor may say, I don't know anything better. Let me, get more information. But if you've done your research and if you talked to others and you've talked to your peers, which is super important, again, with issues that the doctors may not think are related to CH or another adrenal disorder, but you're feeling it, you're having those issues, and then you talk to your peers and they're also having those issues. So it's not all in your head, but you make sure you're talking to your peers, you're talking to a specialist, and insist that if the doctor doesn't have the answers, that they connect you with someone who does, or tell you where you can go to get those answers.
Absolutely. And I would also emphasize along the same lines is that it's okay for you to know more than your doctor about certain things. They're there for a specific purpose. And your job is to support them in trying to figure out what information or what's already been tried related to that purpose. They are absolutely the expert of all the ins and outs about how things work in your body and that particular organ system or overall care. But you know so much. You are the expert in CH. You know your body better than anybody else. So if you know the CH knowledge that goes with that, then you're going to have better outcomes because you can have a partnership with your healthcare provider. And if you reach a healthcare provider who does not want to listen to you and doesn't want to learn, that's when you try to find a new provider. Because this is a teamwork, you guys. This is a long haul. This is not like a short term, like I broke my leg kind of situation. This is chronic disease. All right, so you are doing your normal stuff, your normal things, you're on your medications, you're feeling pretty stable, you haven't had a problem in a while, and then poof, you look like you're gonna have an adrenal crisis or you go into adrenal crisis. How do you know that's coming on? What are the symptoms that lead up to it? What's a medical issue that might make more likely you've got to change some things around with your medications or go to the ER? Dina actually has this amazing resource that can help you with hitting the ER when you find out it's a time to go. So Dina, you want to mention this a little bit?
Sure. So make sure you have all the information you need. Make sure you have a letter from your doctor indicating what condition you have or your child has, what medications you or they are on. Make sure you wear a medical alert ID because that's super important. And make sure you know what medications you're on when you get to the ER. You know, the ER, going to the ER or making the decision to take your child.
Join the meeting.
Very stressful and very chaotic. So, and you're not always thinking straight. We don't always think straight in an emergency. But you as a patient with CAH or parent or caregiver should always be prepared. If you go on our website, we have these little bags where you put your injection and their emergency instructions and everything you need in the event of an emergency. So make sure you have your letter in there, and you can just grab that if you want and bring it to the emergency room with you. Make sure you say, I have CAH or I have adrenal insufficiency. But also, as important, if you can, reach out to your endocrinologist, whether you're at your local hospital, you're going to end up at your local hospital, or you're traveling, or you're visiting grandparents or parents, and you're going to a foreign, quote unquote, hospital. Call your endocrinologist so they can make a call ahead of schedule, ahead of time, so that they're prepared for you. And, you know, they can try to get in touch with the endocrinology on call or the head of the ER at the time, but be sure you have information on your medication, you have a letter that indicates you have CAH or another adrenal disorder. And if you have to get a little bit loud, you get a little bit loud. Especially these days with COVID and everyone is concerned about going to the ER. If you prepare in advance, make sure you have that letter, that medical alert ID, and that you, if at all possible, have your endocrinologist or your primary care physician call the hospital ahead of schedule. So don't be afraid to speak up. Don't be afraid to pull a nurse aside and say, look, my child is having an adrenal crisis. You need to pay attention to him right now. Now, if you are taken to the hospital in an ambulance, you may avoid some of that. But, you know, people don't always want to take an ambulance, and they'd rather take their child or take, you know, their.
Oh, Dina, I think you went on mute.
Oh, sorry. I don't know what's going on here, but, you know, the key word is to be prepared, to have all the information you need. And, you know, most of our patients and parents know exactly what to say when they get to the ER. We have lots of information on our website with resources on what to do in the event of an emergency. You know, going back to the ambulance, if you contact your local EMTs or your local providers, let them know that someone in your household has adrenal insufficiency. So if they were called, they know what they're dealing with.
Yeah, and Dina's point is very well taken. Be loud, because the way that emergency rooms triage is who's in a life-threatening emergency. And obviously there's physically that you can see if you've been in a car wreck, if you've got a broken leg, if you're bleeding, that's obvious. An adrenal crisis is not as obvious unless they're looking. So they have to look, because you know it's life-threatening, but it's not as obvious from the outside.
Great point, Don.
Yeah.
All right, so that leads us to the next polling question. So have you ever been too embarrassed to ask your healthcare provider a question? And I'm sure most of us have. If you feel comfortable sharing in chat what some embarrassing questions are, feel free to do that. But so this is interesting. Let's see, we have a few more seconds. Okay, so it looks like 38%, oh, it's still growing. 38% have been too embarrassed to ask a question, and 63% have not. So kudos to all of you who have not. I know we've all been there, but, you know, don't be embarrassed. I'm sure they've heard everything.
Yeah.
No question is is a wrong question. If you have a question in your mind about your care, about medications, there's no wrong question.
And the best way to get an answer to your embarrassing question is to give a clear question. Because I have people, some of my patients have been like, I've got a problem down there. And I'm like, there's a lot of stuff down there. What are you talking to me about? Is it ED? Is it you got a little bump? Is it, in this case, do you have some testicular masses that we really need to keep track of? Say the words, it's all right. If you don't know the words, it's okay. You can like describe it to people. Forgive your physician if you get a little like chuckle, quirk. It's not they're making fun of you. It's just that either you just surprise them with a new word for it, or you are the first person to ask this question, but they are ready and they're going to start thinking about it as soon as you ask it. It's all about communication again. We talk about this care model, it's all about communication. And the only way to get these embarrassing things talked about is to ask about them. And nobody likes to talk about genitals, let's face it. Nobody really likes to talk about bathroom habits, except for maybe my grandma. But, these are things that we really need to put out there. And it's a safe space when you're talking to healthcare providers. They have seen some crazy stuff, and maybe you're going to add to it. But it's okay, because what you're doing is getting the care you need, and you are being empowered to figure out the answer instead of just sitting home and worried about it. Because if it is a testicular mass and you're worried about, a tumor that's cancerous, what if it's one of these benign lesions that we see? And what's going to happen is they're going to change your medications around a little bit, see if they can get it to go down. And knowing early makes all the difference for the function down later. So, these are the things you want to ask about. Moving to the next one. All right, so this one is amazing, right? So this is showing you, how do you learn more? If you've got big questions, how do you think about these things? How do you understand, what's the latest, greatest treatment that's coming down the road? The first thing is you talk to your care team, remember? Because we made one, and now we're communicating well with our care team, and now we can ask them questions whenever we want. They may not answer immediately, but they will find an answer and get back to you. And you've already determined the best way to communicate, which in many cases is going to be that patient portal. I know you get that patient portal instructions on how to get on there, and it just seems like one more phone call or one more email. And the last thing you want to do is that. I'm here to tell you I'm a believer in the patient portal, because people can ask questions and then it records it so people can look back at to it later. So I told you I'm a quarterback, right, for my patients. A lot of times I will go through all the portal messages that my patients send to other people, because then I can say, it looks like you never got the echo scheduled you needed, because I saw you talk 3 times to the scheduling people there and it never happened. I can help with that. So the communication is tracked. You can get a quick answer, and some doctors are on that portal like magic. So you don't even have to go through anybody like a nurse or an administrative or leave a message. The portal sometimes goes directly to your provider, which is awesome. The other amazing thing, and I think we've proved it again and again during this call, is the Care Foundation, patient advocacy groups, peer support, the newsletter, communities. The way that sometimes you get the biggest support, you understand the disease better, you know what's coming down the road that's useful to you, is going to be through these advocacy groups. So keeping in touch with people, staying in touch with people, watching the website, and learning from people who are really made their mission in life to educate and support you. So let's make sure that we let them do that. Today I had a moment where I looked at one of my coworkers and I said, you need to take some help right now. Because she was trying to do it all and get all this data entered, and other people could help her, but she was not going to accept it. And I think some of the things about having chronic disease is just like being overwhelmed at work. You're overwhelmed, you start shutting down, you put all your bills in a pile in that drawer, and sometimes you just need a little bit of help to take that first step. And organizations like CARES Foundation, organizations that are there to support you, peers can really be like, it's overwhelming. Why don't you first just try calling and make an appointment? It's overwhelming. Why don't you just open one bill and read it to me? These are the things, just by taking one step, can make such a huge difference. So one of the things that I did is worked with my dad, who has a rare genetic condition, to get better information out there on the web. And that's thinkgenetic.com. And if you hit thinkgenetic.com, you'll see questions that are more real life questions. We still go through inheritance patterns and basic stuff like that, but we answer kind of interesting questions that you might have. So, we will actually look at some of the questions you asked here that you get submitted to us and that you've asked in the chat, and we'll see if that makes sense to add to our content too. Like, oh, look, people are asking about this or that. People want to hear about it. Let's add that to our content. And we partner with groups like CARES so they can help us understand the nuances, right? Like, okay, you're going to the emergency room, but you got to be loud. That's the kind of thing that's a nuance you won't get from the literature. You won't get from just being a genetic counselor. It's important that patient advocacy partners with the people writing information so you can do that. And then for clinical trials, clinicaltrials.gov is the fastest, easiest way to learn about new trials, but it's a little bit complicated when you read it, a lot of medical stuff. But it tells you who's going now. You can look at a trial, you can talk to the carriers, you can talk to your HERT people, and then learn more about it. I want to leave some time for questions, but I've been too talky, I'm sorry. So let's just say clinical trials are out there, and the goal of clinical trials is to see if we can come up with better treatments that build on what we've already got. But first, you got to make sure they're safe, and you got to make sure they're effective, and you've got to make sure they're improving what's already out there, or tackling it from a different area so you can layer on top of each other, right? So maybe you can take less of this or more of that and have better outcomes. So they're not for everybody, but you talk to your care team and they can help you figure out who might be there and doing it. So I hope I've convinced you that a care model can really help with better patient care, better health outcomes, feeling better about your knowledge, get you more empowered, and help you stay engaged with your community as well as your healthcare providers. And with that, I'm going to turn it over to Dina and Javier to see if they can sort it out, maybe get some questions.
Okay. Dawn, this is great. Thank you so much. You've been a great partner. So this is what it's all about, partnerships, a care team. And, you know, we're all in this together. They say it takes a village. It takes a village to care for CAH patients. So Javier, I don't know if you want to say so. We did get some questions and we're going to try to answer them for you. As I said in the beginning, if there are other questions, you can certainly send them to us. Send them to where you registered or Cares Foundation, or go to Think Genetic and contact us. But there was a question about medications and the different types of glucocorticoids. So someone was asking about hydrocortisone versus prednisone or other medications. So there were a number of glucocorticoids. Hydrocortisone is often the most recommended for patients with CAH because it's the most structurally identical to cortisol that your own body produces, or that your body does not produce, but does, but a person without CAH would produce. And then prednisone is 4 to 5 times more potent than hydrocortisone, or longer acting. But it can be growth suppressant. And as many of you know, one of the issues with CAH can be growth. So we actually have this information on our website. We have a guide to medications on the fall 2021 newsletter, I believe, but you can contact us and we can give you a copy of that. Someone was asking about new therapies. So we talked a little bit about clinical trials. This is a very exciting time for the CAH and adrenal insufficient community. There are a number of trials. Spruce and others have trials going on. And just today, we announced that the first patient was dosed with the gene therapy for CAH. So it's very exciting. And again, to Dawn's point, the way you learn about this is by being connected to the rare disease community, whether it's, you know, Think Genetic, Cares Foundation, or other organizations out there who are the, you know, experts and the truth, you know, the right sources to go to for information. As Dawn alluded to, don't go to Dr. Google and don't go to WebMD to get your information. Go to a center of excellence, go to an advocacy organization, go to clinicaltrials.gov, because that's where you're going to get the answers to your questions, the right answers to your questions. Javier?
Sure, I'm happy to bring us to closure here. I think our time is up. I really would like to thank you, Dina, and you, Don, for the tremendous discussion. It's been really very, very fruitful, insightful for me, and see how this becomes a true shift in how patients care for themselves and for the people that they care for. You know, doctors are busy. They have a lot on their plate, and and it's hard to keep all those balls up in the air, right? So when a patient comes into the office focused and with clarity around what they want to learn, the whole visit becomes a lot more conducive to improving their own health. So it's been a tremendous hour for me, and I hope that you all on the call have enjoyed it as well. We have another topic coming up in the next quarter called Understanding Your Medications and What's New in Clinical Trials. It's a tentative topic, but one that we think you're going to find useful. So join us in Q2. And with that, I'd like to close, unless anyone, you, Don or Dina, have any remaining topic. But have a great night, everyone. I'm sorry, Don, you were going to say something.
I just want to thank everybody for their attention. I know that this can seem like a really topic, but it's so important, and it's so important to your care. And as so eloquently said, when you're focused and you go in there with a plan, it makes everything better. And I would say, if you want to try this, start again with just a little step. Call your primary care physician or call your endocrinologist and say, I heard about this care model thing. Can you help me figure out how best to start? Just one little thing. If you do one little thing, even that can help improve your care. You don't have to do a whole burrito right now.
Right, and just one more point. If you don't have a center of excellence near you, we can help you get an appointment there. And most of your local physicians are willing to work with experts at a center of excellence and vice versa. So we encourage you to do that. So you have the ability to, or your doctor will have the ability to gain some knowledge from those experts. So we're happy to help, connect you.